Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How addictive is Oxycontin, Oxycodone? Oxycontin, Oxycodone, is a highly addictive opioid pain medication. Addiction to oxycodone can occur in anyone, even at recommended dosages. However, there are certain factors that put people at a higher risk of addiction. It's important to follow your doctor's instructions and to take the smallest amount of oxycodone for the shortest amount of time possible to lower your risk of addiction. Is Oxycontin, Oxycodone, a controlled substance? Oxycontin, Oxycodone, is classified as a Schedule II controlled substance by the U.S. Drug Enforcement Agency, DEA. It carries a boxed warning, the strictest warning an FDA can give, about its potential risk of addiction. Additionally, it is only available through a restricted program called the Opioid Analgesic Risk Evaluation and Mitigation Strategy, REMS, to make sure the benefits of oxycodone outweigh the risks of addiction, abuse, and misuse. Why is Oxycontin, Oxycodone, addictive? Opioids like Oxycontin, Oxycodone, are addictive because they activate the reward center in the brain. This means it triggers the same chemicals in the brain, for example, dopamine, that reward you with feelings of pleasure from doing certain activities, such as eating. The brain creates memories of these good feelings that are associated with oxycodone, which sometimes leads to continued use of the medication even in the absence of pain. After taking oxycodone for a certain period of time, the body starts to depend on it to function normally. This is called physical dependence, and it can also lead to addiction. What are the signs of Oxycontin, Oxycodone, addiction? In general, drug addiction is defined as continued use of a drug despite negative consequences. Some signs of addiction to watch out for include struggling with maintaining relationships, putting yourself or others in danger in order to continue taking oxycodone, having financial problems because of oxycodone, spending a lot of time trying to get oxycodone, failing to take care of responsibilities at home, school, or work. These aren't all of the possible signs of addiction. If you or someone you know might be addicted to oxycodone, talk to your doctor to get help. Related questions: how long does oxycodone stay in your system? Which drugs cause opioid-induced constipation? How long does opioid withdrawal last? How soon can you become addicted to Oxycontin, Oxycodone? Addiction to Oxycontin, Oxycodone, could happen to anyone anytime after starting the medication. This is different from physical dependence, which usually takes several days to weeks of continued usage of the medication. What are Oxycontin, Oxycodone, withdrawal symptoms? If you stop taking oxycodone abruptly, you could experience withdrawal symptoms. Sometimes, they can be severe or even life-threatening. Withdrawal symptoms are more likely to occur if you have been taking oxycodone continuously for at least several days. Some potential withdrawal symptoms include agitation, anxiety, diarrhea, muscle pain, runny nose, sweating, trouble sleeping, vomiting, yawning. Withdrawal symptoms can begin as soon as 4 to 8 hours after the last dose of oxycodone. It is possible for withdrawal symptoms to change over the days following the last dose. Early symptoms typically include mood and sleep changes, as well as flu-like symptoms. Stomach symptoms tend to appear later, such as diarrhea, nausea, and stomach cramps. For most people, withdrawal symptoms start to go away after 3 days. However, they can persist for 2 weeks or longer for some people. Oxycodone should be tapered down slowly before stopping completely to minimize withdrawal symptoms. How do you treat Oxycontin, Oxycodone, addiction? Treatment for Oxycontin, Oxycodone, addiction is very individualized. Many times it includes a combination of medications used for substance use disorder, therapy, and support groups. Options for treatment may include managing withdrawal symptoms while detoxing from oxycodone, rehabilitation at a facility, Inpatient or outpatient medications, for example, buprenorphine, methadone, naltrexone, Vivitrol, cognitive behavioral therapy. Support groups, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.